Today, we're exploring the crucial links between housing stability, quality, and overall health and well-being. We're pleased to welcome Jake Rothstein, CEO of Upside. Jake's work is centered around enhancing the quality of life for older adults, with a strong focus on innovative housing solutions that support health and well-being. Jake's leadership at Upside reflects a deep commitment to improving senior housing through technology and thoughtful design. Also joining us is Ashley Meehan, a PhD student at Johns Hopkins Bloomberg School of Public Health. Ashley's extensive background includes impactful work at the Centers for Disease Control and Prevention, contributions to the U.S. Department of Housing and Urban Development, and collaborations with the National Healthcare for Homelessness Council. Ashley's focus bridges public health and homelessness, seeking effective support strategies for vulnerable populations. With these rich backgrounds and expertise in housing and health, we're set for a great conversation. Jake, I'll hand it over to you.
Spencer, thank you for the kind introductions. Ashley, it's a pleasure to be with you today. It means a lot to share this passion for housing and the intersection of housing and healthcare with someone that also shares that. And with your level of expertise, I think we can have a really great conversation, and I can learn a lot. I'm excited to learn from you. And so, we can just start kicking it off. Would love to get your thoughts on maybe discussing some of the direct and indirect ways in which housing stability, from your perspective, impacts an individual's health and well-being, just generally speaking, and then I think we can kind of peel the onion back.
Yeah, absolutely. I really like the analogy of an onion. So I like to think about how housing impacts health as a set of concentric circles, kind of like an onion. So in public health, we use what we call the social ecological model. And at the center of that model is a circle that really describes an individual's experience in their physical body. So what are their genetics? What are their behaviors? What kind of underlying health conditions do they have? And of course, we don't live in the world as individuals on our own. We are all embedded within the next concentric circle of relationships. So our social relationships impact what we have access to, our types of emotional and mental support, and our ability to cope with life stress. And our relationships help make our lives better. It helps us stay well. And then next out, our relationships are embedded in our communities. So what kinds of green space do our communities have? What kinds of other resources and support exist in our communities? So where our housing is located within our communities also impacts what we have access to in terms of food, in terms of transportation and employment, and all of that impacts our health. And then at the outermost layer, we have societal or structural policies and factors that I think have a bigger impact on our health than we realize. So things like minimum wage policies, or who is or isn't allowed to take out a mortgage loan, or where people can afford to buy or rent housing. All of that impacts our health. And so I think there are really direct ways that housing impacts our health in terms of what we're exposed to, where we live, and who's around us. And then I think there are some more indirect ways, like these bigger policies around housing that impact our health.
That's really, really interesting. And it kind of brings me to the next question I had around this topic regarding policy and programs. I mean, we talk a lot about, when we talk about housing kind of broadly and from a government perspective, or even from a local perspective, we talk about the challenges and how there is an overwhelming amount of challenges regarding housing. We're focused in many ways around the older adult population and the coming crisis, or maybe the crisis that we're already in regards to housing and affordability for older adults as they age and as they live longer. But can you talk maybe a little bit about some of the programs or the policies that can be a part of the solution to some of these, major challenges that we regularly talk about, but don't always talk about the solutions?
Yeah, that's a really great question. And I think my inclination is to think a bit more upstream. Maybe that's the public health in me, but to think about policies that maybe don't seem quite directly related to housing, but I'm thinking about things like increasing the minimum wage. Our minimum wage impacts where we're able to live, what we can afford, what kinds of food we have access to. So I think when I'm thinking about housing, I'm thinking about all of the other things that also contribute to our ability to have safe and affordable housing and to live in places where we feel that we can be our full selves. I don't know if that's really answering your question.
Yeah,
Yeah.
That's really super helpful. I think that part of the challenge that we face from as a operator in this space, and kind of on this journey of figuring things out to try and make a big impact to a lot of people, is this idea of health outcomes and housing, and how we relate and tie health outcomes to housing. I think it continues to be a challenge, and it maybe for the foreseeable future it will be. But you have Z codes, and you have ways that providers maybe tag certain environmental issues as it relates to someone coming in with a claim. And so when we look at things through the lens of insurance providers and payers, and payers are typically used to analyzing claims data all day. And so when a payer comes to us and they say, well, housing is really a very important social driver of health, we understand that kind of academically, we understand it anecdotally, but how do we go about, on a granular level, understanding how those outcomes are actually going to be tied to claims? Because when 87-year-old Beverly checks into the emergency room because of a broken hip, she might have broken that hip because she was living in a place that was unsuitable for her, in a place with stairs, or maybe a place with a split level ranch, or whatever it might be. Those housing related issues aren't being tied to claims currently, or certainly not being tied to claims effectively right now for us to even make really great, what's the right word that I'm looking for? Assumptions, or draw really great conclusions as to how housing and health is income. How would you think about that?
Yeah, that's a really great point. So there's actually an article by two authors called Swope and Hernandez, and they outline this conceptual framework for how does our housing impact our health. And I really like their framework because they outline 4 pillars: cost, conditions, consistency, and context. And so they're really talking about, across these 4 pillars, like how do these things play out directly and indirectly on our health. And I think, to your point, Jake, one of the things that, as I was reading their paper, like I forgot about was that, the conditions of our homes can lead to injuries, can lead to respiratory issues. We can be exposed to things that, we might not need to be exposed to. And so I think, this is also getting at this idea of our siloed structures and siloed sectors. So, we have the healthcare sector that's operating in their lane and doing what they do really well. We have public health operating in the public health lane, and we have our housing and homelessness response systems operating in their lane. And I think it is that way because that's how it's funded from Congress. Money is tied to different things. But I think what's really in front of us is the need to work across these sectors and communicate and really make the case for a clinical care network or an insurance provider, like why should they care about housing, and how do we get the right people to that table to have that conversation? Same thing with public health. How do we get homeless service providers to the table with public health agencies so that they can communicate about the different things that they're seeing and how their different ways of operating and ways of thinking can align for some shared values. Something else that you mentioned that I recently have been learning a bit more about is incorporating the social determinants of health data into risk stratification for different insurance providers and clinical care networks. I'm not too familiar with what that current landscape looks like, but I think there could be an opportunity to think about some sort of risk stratification on the basis of housing as well, to really anticipate like what kinds of healthcare needs might people have with different housing scenarios. So I'm really curious to see where that work is at and where it's headed.
Yeah, you bring up a couple of really good points there, but the risk scoring, the risk stratification is really going to be an important thing, I think, as a way to get us to ultimately being able to physically tie claims to housing related issues. We talk about a lot of times in housing quality, and we talk about stability. So Upside comes at things from a stability, from both a quality and stability perspective. But a lot of times when we're talking to our payer clients, and we're talking to members even, it's the first thing is stability. Like, how do you get people into stable housing? And then once someone is in stable housing, quality is really, really important. But what I think a lot of times is missed is that you have a lot of people that might seem stable or aren't answering surveys and showing their instability, but are living in really improper or inappropriate low quality housing, and that's impacting health in numerous ways. So I think that how do you look at quality versus stability from, from your perspective?
Yeah, I don't tend to favor one over the other. I think it's a both and. And I think the Stolp and Hernandez paper, which I encourage everyone to read, outlines those are two of their pillars. Consistency and conditions. I think all of these things are tied up in I think, again, like these other bigger policies, like if we can't afford the homes that we live in, how can we ensure that the conditions are what we need and are safe for us? If we can't afford our homes, how can we make sure that we stay where we are? I believe the US Census Bureau estimated from 2017 to 2021 that over 40% of renter households were spending more than 30% of their income on housing, which is huge. And so people who spend more than 30% of their income on housing are technically considered to have high household cost burden. And I think that's really concerning. And if our policies around Social Security, or if retirement funds aren't set up to cover the increase in cost of housing, then I don't know if that 30%, not spending 30% of, or not spending more than 30% of our income on our housing is going to be realistic for a lot of people. So I think, consistency, stability, and then quality and conditions, I think, are all tied up in cost and in our ability to afford and keep up with the rising costs of housing.
Yeah, there's so much nuance there, and I think that a lot of times, if you don't have a lot of experience in this arena, or you're not playing in it all day long and talking housing and thinking housing, it can really be oversimplified. Everyone thinks it's, I think that kind of high level, it's like, oh, housing's complicated, but really it's housed or unhoused, or housing unstable, or housing insecure. It's so much more nuanced than that. And so, a lot of times when we're coming at these conversations, we're trying to expose a lot of the nuance that really exists here. And it goes to a deeper kind of point that I want to bring up around specific populations. So I'm wondering if you think there, or of specific populations or demographics that might be particularly affected by this intersection of housing and healthcare. Like, we look at it from older adults, but from your experience, what do you see in terms of the specific demographics or populations that might be most impacted here?
Yeah, I mean, I would also talk about older adults. So, we have a growing older adult population, and I think their housing and health needs are going to start intersecting in bigger ways for our country. The other populations that I am drawn to are people of color, people living in low-income neighborhoods, people who have experienced early childhood adversity and violence. I think those groups are groups that I'm particularly concerned about. So I'm thinking about the historic and contemporary policies that have intentionally put a lot of these groups at structural disadvantage, and created conditions where people live that are not healthy and are not meant for them to stay well. So I think those are the groups that I'm most concerned about in terms of housing and health. Yeah,
makes sense. So from an upside perspective, we, in our conversations with payers and people across the healthcare landscape, we come at this from a very housing first, like, we're housing first, and we talk about housing first, and everyone's talking about social drivers, social determinants of health, and they're talking about food, and they're talking about transportation, and they're talking about healthcare access, and all these really important things. And it feels to us when we have these conversations that, like, okay, well, you're talking about really important things, right? But if you can't get housing fundamentally right at the beginning first, if you can't ensure someone's in stable housing, in proper quality housing, in suitable or sustainable housing, how can you actually effectively deploy all of these other SDOH type of programs of, and actually expect long-term tangible results on outcomes? Thoughts on that?
I think you said it really well. I also am someone who's a big proponent of housing first. And to your point, it's not housing only, it's just housing first. And I think that's something that maybe gets lost in programs or planning or efforts. But I mean, I think there's something to be said about the power of having a mailing address. What does that mean in terms of benefits that you can sign up for and receive? What does that mean in terms of ability to find a job or stay employed? So yeah, I think to your point, exactly, housing must come first. Sometimes I think about Maslow's hierarchy of needs, and at that very bottom level, it's not food and then housing, it's housing and food. It's housing and right to a safe environment. So I think if we're thinking about that hierarchy of needs pyramid, shelter is one of the first and foremost things that we need to stay well.
It's funny you mentioned Maslow, because we have that in many of our presentations. We use Maslow's hierarchy as, to articulate that exact point. I mean, it's so fundamental, it's so foundational to getting, a proper health right. And I think you're right. I mean, what we see all the time is this stratification and the siloing of healthcare. I mean, it is really, and you have ownership. People within healthcare organizations have ownership over a very specific population or a very specific line of business. I'm population health, or I'm health equity, or I'm blah, blah, blah. And it's so siloed that it's very hard for groups to see across the aisle. And so I think that your point about bringing different stakeholders within an organization that are all responsible for the whole health of a person, bringing them together around the table, and then talking about how housing first is so incredibly important to each one of those buckets is kind of the starting point. But I think talking about these things is part of what's going to help move the needle here. The second thing that I think will help move the needle is just the demographic shift. I mean, we talk about older adults mostly in our business, even though we are able to help a variety of different populations, and we do work with a variety of plans with different types of populations. But the need around older adults is so in your face, it's so prevalent right now that it's really hard to ignore. So just thoughts on current trends. So based on what we're seeing current trends wise from a housing standpoint, and the conversations that everyone seems to be having around housing now, what kind of predictions can you make maybe about the future of housing and its impact on public health, or this intersection of housing and health? Like, where do you see this going?
Yeah, I was thinking about this question before, and my prediction really is going to come from my own vision and hope for where we're going, not necessarily from data or research or anything like that. But I think at some point, you've alluded to this, we're going to reach a point where we won't be able to ignore the housing crisis any longer. And I'm not 100% sure what it's going to take for us, a collective society, our government, to get to that point where we acknowledge, like, okay, we have to do something. I'm not sure what it will take for us to get there, but I think at a certain point, we're going to have to acknowledge this very real reality and do something about it. And so I think about public health a lot. We talk about these upstream drivers of health, and we document the disparities based on these different drivers of health. And in, the scientific manuscripts that we write, we say there's a need for more housing as a solution to these health problems. But when we actually look at what public health is doing to get people into housing, it's hard to find. And so I think about that a lot of, at what point will the actions reflect what we're saying? And obviously I'm speaking from a public health lens, but I think that applies to a lot of different sectors that acknowledge the social determinants of health as well. I think one of the things that I'm hopeful for, and I think this builds off of this, multi-sector collaboration and bringing folks to the table, but also streamlining our data, so just like our actions are siloed, I think our data are siloed. And, our data systems aren't communicating with each other to know what the full picture of health or illness looks like in our communities. And we don't know what different diseases look like in terms of housing status at a national level. And so I think as we think about what comes next and how we move this needle forward, I'm also thinking about data and communication across data systems, and having systems that are interoperable, and having data standards that can communicate across a housing system or a homeless management information system, and across a hospital's healthcare system. And so, we think about clinicians or clinical care providers who are documenting these social determinants, but it only kind of, for some of them, it only kind of lives in their, electronic health record system. And where does that go? And I think if we had data systems that were able to communicate with each other, and a coordinated response at, a government level within communities, we might be able to follow up and say, hey, this patient, we put in a request for housing, and we were connected to our housing data system, and we were able to get them into housing that met their needs, and was what they wanted, and they're on the right track. And so I think that data system integration is critical for whole person care and whole person well-being, and that takes everyone coming to the table and working together. The other thing that I am thinking about, and I'm sure there's other solutions, and I know not everyone's going to agree with this, but I tend to fall on a side of the spectrum where I think maybe we need a little bit more federal support at this time. And I'm particularly thinking about more federal agency support for setting higher floors. So, when we're thinking about minimum wage, how do we have at a federal level, like, this should be a livable wage and this should be the minimum, and, states can go above and beyond that. But I think until then, we're going to continue to see disparities by state, by community. And I don't know that that's been working for us. And so I think in the future, I would hope to see a little bit more help from the federal government. And I know that's not maybe a popular answer, even temporarily, just so that we can, start lifting folks off the floor, and give people a better place to start from. So that's what I'm thinking for the future. I don't know if we'll get there. I don't know if any of that will happen, but that's kind of where my hope and vision lies.
That's awesome. First of all, we share a lot of the same vision. I think that it's not going to be a one fix. There's not going to be one solution or one government entity or one private enterprise that's going to fix all these problems. I think it's going to be a joint effort, and it's going to be not all at once, but it's going to be a slow burn to get us to the right place and to get us to where we need to be. I think your points on data, and we've seen this too in the consumer side of our business. We've seen that once you sort of control holistically the home, the roof over someone's head, you can start really understanding from a whole health perspective the things that they're doing. You can understand when their doctor's appointments are. You can understand what food they're ordering. You can understand how often they're taking transportation to go see their grandkids. All of these really important things that live today either in silos or they're not recorded whatsoever, start becoming really clear when you can build a relationship around the home with people. And everyone talks about this. We've done it a little bit, so we've got some experience doing it and seeing how it actually works, which is really, really remarkable. The other thing is, I think that it's not just a build more housing solution. Like what we've seen is so much of this, and certainly in the healthcare world, and the big health plans do this. Let's build more housing. Let's build more housing. It's building the right housing, first of all. It's ensuring that we're spending the resources and we're spending the time and the effort to build appropriate housing for people. And what we've seen from an older adult perspective is it's not just age segregated housing that's important. It's intergenerational housing that meets compliance standards for older adults and for younger people. And this concept of universal design. I mean, these things they're starting to be talked about, but of course we're in such short supply. So one of the things that we think about all the time is, well, how do we utilize existing infrastructure to make it suitable for older adults, or to make it suitable for perinatal population, or to make it suitable for a population that actually needs supportive housing, or housing that's just appropriate for them. So I think that it's not just building more, it's not just adding more layers of data connectivity, but it's the right buildings, it's the right data, it's the right everything. And that's a dream for us. I mean, that's like kind of the goal for the entire healthcare system, is if we can get data, interoperability, that would be amazing. And I think we've talked about that as an industry in the healthcare industry for a very long time. But we're getting closer, and there's lots of reasons, I think, to be hopeful.
One of the things that actually came up in school for me last year, that I really hold on to, is this analogy of like a deep flowing river. And so I'm not sure if you've heard the public health analogy of, like, you have folks upstream, you have folks downstream, and public health is trying to keep people from jumping in upstream or keep them from falling in upstream. So there's a lot of river analogies. So this one's a little bit different, but if we think about our society and our structures and our systems as a deep and fast flowing river, people are kind of floating along with the river, and all it takes is one person to try to swim in a different direction, and it's going to be hard, and it's not going to be fast, but eventually enough people start swimming in a different direction and the course of the river changes. And I think that is something that keeps me going, of like, okay, even if it's just me swimming against the current into the bank and it feels like I'm going nowhere, eventually with enough momentum, the course of the river will change. So I think that's something that I try to remind myself of and keep my eyes on.
We're not going to change the world overnight, but we can change the world, and we can change one person's world. And if we can change one person's world, we could probably change a dozen and 100 and 1,000. And that makes me happy. That's very gratifying. But it's like, it's not a switch of a flip of a switch.
I often find myself oscillating between this like radicalist and incrementalist approach to thinking about housing and the structural and social determinants. Because sometimes I'm like so frustrated by these upstream systems that are operating as they're intended to, but also operating inequitably. And so, you know, I'm like down with everything, like let's scrap it all and start over. And then other times I'm like, okay, let's focus on what's within our control, you know, push against the walls that are around us right here, right now. And you know, sometimes that swing of the pendulum feels a bit chaotic for me, but one of the things that keeps me going are the other people who are doing this work, and at just the very stark reality that people are living every single day without a roof over their head.
Listen, Ashley, I'm really excited to have had this conversation with you. Your insights are really invaluable and your experience is amazing and incredible. And I'm excited and inspired by the work that you do. So really appreciate you taking the time to chat with us for a little today.
Yeah, thanks for having me.